Hey, Dr. Mike, how are you today?
Hey, hey, here we are again.
Absolutely. Great to see you.
Nice to see you too, Conrad.
Awesome. Thanks for joining us today. Today is our second installment of Ask an Expert. It's my pleasure to connect with you today. Today we're going to talk a little bit about why ketamine and what is it like to kind of work with Field Trip. So I'm
Yeah,
really excited to get that conversation with you. And as we get going, I just want to welcome everybody who's joining us. And I'd like to just do a quick introduction for you, Dr. Mike. Dr. Dow is a psychedelic therapist out of our LA clinic. Aside from being a part of our team, he's becoming well known as America's go-to doctor, and he's hosted shows on TLC, VH1, E, Investigation Discovery, and Logo. And you're also part of Dr. Oz's core team of experts. You've brought consciousness expansion and mindfulness to the forefront of mainstream culture, and we're really grateful for that. And we're really grateful to have you on our team, and thank you for joining us today.
it's a pleasure.
Awesome, awesome. So again, I'd like to welcome everybody. Today we're going to talk, on the heels of, a lot of interest in how to change your mind. Last week we spent some time talking about some of the five most important things you need to know before you start psychedelic medicine, and we had a great feedback. And today, like I mentioned, we want to know a little bit about ketamine specifically, like why ketamine and how do we work with it?
Ketamine is, in my opinion, one of the most versatile and most effective drugs when it comes to mental health. So for those of you who've been watching or reading either the Netflix How to Change Your Mind or the book by Michael Pollan, you've heard and seen patients go through MDMA-assisted psychotherapy, psilocybin-assisted psychotherapy. The difference between those therapies and ketamine-assisted psychotherapy is that ketamine is the only one that is legal right now in the United States and in Canada. Psilocybin we do have at our Amsterdam Field Trip Clinic, but right now, if you are living in North America, this is the psychedelic medicine that you can legally receive with trained healthcare practitioners, really making sure that you have a safe journey, optimizing set and setting. It's effective for depression, often effective when everything else has failed. We have a lot of patients who come into Field Trip, they've tried countless prescription antidepressants, they've tried talk therapy. Ketamine-assisted therapy helps existing treatments to work better. So if you're in ongoing therapy, it will only deepen that process. If you are on a medication, an SSRI, it will help that work better if you want to stay on that. That being said, many people are finding that this is an alternative. They really like the lack of daily dosing. So getting started is really interesting because we do this preparation session. You'll see on our website, we have these programs. The one that I would say most of our patients gravitate towards is the one that says 6 exploration programs. So exploration is one of our ketamine-assisted psychotherapy sessions. But because set and setting is so important, we also do what we call our preparation session the day before. That's 30 minutes online. You're going to be the next day at the clinic in our exploration session, which is, again, that medicine session when you're actually taking the medicine. When you look at the 2 options on our website, we have the individual treatment and the individual plus extra support. And the difference between those 2 models is the therapist in the room with you the whole time? Or is the therapist and our medical staff remotely monitoring you? So you can see if you are doing the 6 exploration sessions, and one of the reasons why we stack those sessions is because it is much more effective for depression, anxiety, PTSD, and also other disorders, so addiction, OCD, eating disorders, when you stack those together. So you're going to get not only a profound response, but the reason why we stack them, sort of looking at an x-axis and a y-axis, you're going to get a really profound response every time. But when we look at this x-axis of time, how long does the treatment last? By stacking those 6 sessions together, it's now going to last you a much longer time. So if you go to a clinic that is not a ketamine-assisted psychotherapy clinic, they're going to give you ketamine in an IV. We do something very, very different. We do an intramuscular injection. It tends to give you more of a true trip feeling because all the medicine is entering your bloodstream all at once versus an IV that's sort of slowly doling out the medicine in your body. And then I think one of the reasons why Field Trip is the gold standard around the world, not only are we the world's largest provider of psychedelic assisted psychotherapy, our doctors, our mental health practitioners, we are the best in the world. We are the most trained. So you're in very, very good hands. And we've had just really profound effects. So looking at, and we also wanted to make this affordable. So if you're looking at on our website, the individual treatment plus extra support, so that includes your therapy, your therapist in the room with you the entire time. The total for that is $6,750, which is obviously a lot of money for some people, which is why we also have payment plans. So that one, if you want to pay monthly over 24 months, then that one is $281 a month, which makes it much more affordable. For the remote therapy, so your therapist is going to give you that preparation, still going to give you the integration sessions. That one is $219 a month, or paid all at once is $52.50 US. I will also say that while this treatment is profound, and yes, it can be expensive to start, the great news is once you finish that protocol and we stack those 6 exploration or medicine sessions together, then, you know, the other thing that really sets us apart from IV clinics is research shows that their effects only last about a month because we are combining the medicine. To us, the medicine is just a conduit. The medicine is just a way that we can actually make all of the psychotherapeutic interventions, so cognitive behavioral therapy, internal family systems, psychodynamic therapy, hypnosis, all of these things that our clinicians are trained in, including myself, and the things that I use with my patients, it makes it work much longer. So on average, our patients' improvements are profound. Number one, going from severe measures of depression and anxiety down to mild. And then it's also lasting not 1 month, but on average 4 months. So after you start, it's actually pretty affordable to keep going, because then people will only need around 1 session. Oh, I see IFS, love, 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 me too. Only 1 session every 4 months. So while it's time consuming and a little bit expensive to start, it's really not all that time consuming to keep it up. I would say the other, one more thing before I let you ask your next question. The other bonus with ketamine is not only is it a very versatile medicine, so the low, medium, and high dosing to me feels like a totally different medicine. So we can really have this individualized treatment. And then also it doesn't last that long, which I think is actually a plus for most people. If you go to have psilocybin assisted psychotherapy or MDMA assisted psychotherapy in a study right now, that's an all-day process. So if you go to our Amsterdam clinic, most people at our Amsterdam clinic are not Dutch. They actually fly in from other countries to have that treatment, but you're there all day. So obviously you have to take a full day off work. You can come to us, you know, at the LA clinic, we do evening appointments on Mondays and Thursdays. So if you come in at 5 p.m., you'll be done by 8. So it really is a little bit more workable for people who are parents or who are taking care of an elderly parent or have a full-time job. So yeah, it's just remarkable. It's the most rewarding work I've ever done.
Oh, that's beautiful. I share that sentiment. I'm so lucky and grateful to be part of the Field Trip team, and we talk to amazing people. We do fantastic work. We have the most seasoned and caring medical and clinical teams that I've ever come across. So yes, so it's a beautiful team here, and thank you for that summary.
Yeah, of course.
Awesome. So actually, I heard you say lots of stuff there. So maybe we can unpack just for a minute.
Yeah.
We talked about ketamine assisted psychotherapy, which is what we offer. And you started kind of highlighting the idea that is legal. That was one of the first points you made. So ketamine is legal in Canada and the United States, and is essentially the only legal psychedelic that people can access today.
Correct.
Awesome. Then we talked a little bit about our process. So you started to touch on like what preparation means, and our process was really as part of a set. So people would sign on to like either do a set of what we call core 4 or core 6 if they need a little bit extra, which is a combination of setting up their intentions with their therapist, which is like a dedicated appointment, where what happens there, we kind of get the client and some of their goals and some of their treatment history. Is that correct?
Correct. And the preparation and the integration, it really is life-changing. It is really how we integrate the medicine with the psychotherapy, making both even more effective. It is not, I see a question, it's not a natural plant medicine. It was originally, they were looking for a less problematic version of PCP as anesthesia, and they found it in Detroit around 1959, 1960. Around 2000, they discovered in a lot of studies just how effective it is at much, much lower doses. So you could say sort of not really microdosing like psilocybin microdosing, but it is sort of a microdose when you can compare it to the way it's used as an antidepressant.
Mm. This is fantastic. So ketamine is really, it's been around for a long time. And in the way that it's being used now in combination with psychotherapy is starting to gain popularity. Maybe you can talk a little bit about some of like the supporting research that we've seen around this combination of ketamine with therapy.
This medicine, I think one of the most remarkable things why it is so different in mental health, isn't it just so mind-boggling that if somebody is in a depressive episode or has very severe anxiety and they go to a mental health care professional, whether that's a psychiatrist or a psychotherapist, and whether you're doing talk therapy or meds, or even some of the newer modalities like TMS, transcranial magnetic stimulation, where a magnet is over your brain. All of those modalities take weeks at the very least to work, right? So even TMS, which is a newer form of treatment for treatment-resistant depression, like ketamine-assisted psychotherapy, there's no relief for usually 3 to 4 weeks. Med, same thing. Psychotherapy, you're not going to get, one session is not going to give you that rapid relief. So I think in research, to me, the most exciting thing, when people are suffering right now, this is a medicine, this is a treatment, this is a protocol that provides rapid relief. We are talking so even though we're stacking, we talked about the core 4 and 6, so 4 or 6 expiration medicine sessions. The benefits, you're going to feel them after your first dose, within usually on average 4 hours of that first dose. You're going to feel better. So less depression, less anxiety. We use 2 standardized assessments. We use the PHQ-9 and the GAD-7. All you mental health professionals will know what I'm talking about. But on average, our clients at Field Trip are coming to us with scores that are in the severe category. So this is pretty debilitating depression, anxiety, PTSD, and again, other disorders on a case-by-case basis. So addiction, eating disorders, OCD, and the improvement is immediate. How exciting is that we finally have something that provides rapid relief? In fact, in research with people experiencing suicidal thoughts, after 1 dose of ketamine, in the majority of patients, the suicidal thoughts go away. Imagine how many lives we could save, right? Mm-hmm. Because you can restrain somebody and put them on a psychiatric hold for 72 hours, but they don't actually feel better after 72 hours. You're just providing for their safety, which is a great thing. So I think when people have that severe depression, we finally have something that will work well and work quickly. There's really nothing else right now in 2022 that will give you rapid relief from your symptoms.
Got it. So in your experience, clients, once they receive the medicine, they feel that the impact of the medicine on their body right away, and they have an experiential experience.
Yes.
The thing is also the runoff effects start to last for hours after and into days later as well.
Yeah, so usually on average, so the reason why we have on our website like the 4 or the 6 medicine sessions with, a preparation session before and then integration sessions after and in between those medicine sessions, is with every medicine session, it'll last longer. So I would say on average, that first medicine session, you're going to feel a real lift in your mood or a reduction in anxiety, and it's going to last a day or two. After that second session, and this really depends on the person because, at Field Trip, our dosing is so personalized based on you. We don't dose you based solely on your body weight. After dose 2, it's going to last, hopefully 3 or 4 days. After dose 3, it's going to last hopefully a week. After dose 4, now we're talking about long-lasting, sustained relief, but not just relief. So one of the other things I want to talk about is the mechanism of action. So ketamine actually, unlike the other medications, the most widely used medication for depression, anxiety, and PTSD, yes, it is going to lift serotonin like the SSRIs. Yes, it does lift dopamine like Wellbutrin. So those are both antidepressants. Sometimes SSRIs are also used for anxiety. Yes, it is going to be effective for PTSD. But then, what we see, so if you have an anxiety disorder, if you have depression, if you have PTSD, your improvements, your reduction in symptoms only last for as long as you take that medication every single day. Ketamine is actually doing, while it's lifting those neurotransmitters, it's also fixing your brain. It's actually making your brain better, which is what makes me really excited. So if you're a biohacker, if you are somebody who is about longevity, you'll be really excited to know that ketamine boosts BDNF, that's brain-derived neurotrophic factor. That means it's helping your brain to make new brain cells. So I tell the people that I work with, it's sort of like after your session, it's sort of like your brain becomes a little bit like Play-Doh, like hand a child some Play-Doh and it's like, well, what do you want to do with this? Imagine like that Play-Doh is your brain and what you make is your life, your new rituals, the things that you do. So now all of a sudden you see how the integration of the medicine plus the therapy actually works. Because if you are feeling really depressed and a therapist is trying to help you to understand your trauma, reprocess it, sometimes if you saw the Michael Pollan episode on MDMA, your brain won't let you go there. But ketamine, like MDMA, is an empathogen. So it makes you put down your defenses, the parts of your personality that are sometimes at war and trying to keep you safe and trying to prevent you from feeling something painful. They sort of soften. And certainly in the high dose and medium and high dose sessions that we use at Field Trip when appropriate with people, some of those parts go offline entirely. What would it like for anybody watching today, if you know what I'm talking about, those parts of you that try to rescue you and keep you safe and prevent you from trying to feel that pain or medicate that pain? So maybe there's a part of you that is engaging in risky behavior to try to squash the fires of that pain. Ketamine really turns off all of those parts of your personality temporarily. So from a research point of view, what it's doing is it's deactivating the default mode network, the DMN, which is sort of, I call it the me network because it's self-referential. So it's looking at everything through the lens of myself. So in many ways, it's like psilocybin, like LSD, it's sort of turning off or dimming the ego so that you can feel what we call self with a capital S. What is self? Well, it's sort of, if this is the ego and the ego is on the surface, down here we have the self with a capital S. It's the seat of consciousness. People say it's where if the divine is within, it's in the self. It's the part of you that knows that you have these parts of your personality that are doing different things. That is why sometimes with addiction or with anxiety or even with behaviors that that some part of you, like the cartoons, like the angel on your shoulder and then the demon. It's like, those parts of you are at war. What would it be like for you to actually step back and feel what it's like to be who you really are? That is why we have such remarkable outcomes, again, because it is really about the integration of the psychotherapy with the medicine where, in my opinion, the magic really is.
Got it. Thanks so much. That's a really great explanation. There's a few things I want to unpack there, but before I do, I just want to welcome anybody who's recently joined us. Today, we're being joined with Dr. Michael Dow. He's here to talk to us a little bit about specifically around ketamine and why we use it and how it's used. So, Dr. Dow, thanks again for joining us. We did have a quick question that came in from Quantum Counselor. She asked if there's any side effects to ketamine, and I thought maybe you could touch on that for a minute.
Yeah, so most of the side effects that we see in SSRIs, most notably weight gain, sexual dysfunction, and emotional blunting or numbing. So a lot of people in SSRIs say that, yes, it cuts off the bottoms, but sometimes it also feels like it cuts off the tops. Ketamine doesn't have any of those side effects. So in my opinion, the people that I've worked with, they tend to have better sexual function. They tend to actually lose weight if that's part of their reason. We know that changes in drives and basic functions like sleep and sex and hunger really start to change when you have depression and sometimes anxiety and PTSD as well. So when you can treat that, usually those get better. In terms of side effects, there is a temporary spike in blood pressure. So, we do at Field Trip, we are really, we're offering a groundbreaking treatment, but we are also always primarily concerned with your safety using a very legal medicine. Again, the only psychedelic medicine that is currently legal in the United States and Canada at this time. So sometimes there can be this spike in blood pressure, which is why high uncontrolled blood pressure is a contraindication. So we cannot use ketamine if you have uncontrolled hypertension, but if you're on medication that brings that controls that hypertension, we can use it. And then the other contraindications are pregnant or nursing, schizophrenia, or uncontrolled bipolar disorder. Bipolar disorder is sort of a gray area. We definitely do not use it when somebody is in active mania or hypomania, but ketamine-assisted psychotherapy actually can be effective for people with bipolar disorder, as long as we have to be a little bit more careful in the way that we use it. But, a lot of research shows that it is effective. We do a lot of, sometimes there is a transient, I would say that for most people, and especially if you score high on personality traits like openness, or you've had a lot of experience with different psychedelics, maybe even ketamine. If you're somebody who says, wow, I've tried psilocybin, I've tried LSD in my 20s, or, maybe in the 60s, and I've always had these wonderful trips, then we'll say, okay, great. So we can probably go a little bit higher for you. If you're somebody who's coming to us, who's a little bit more nervous, so you're not that open, you've never tried a psychedelic, this is all new to you, then we're gonna really work with that. And during your first session, we're probably gonna go a lot lower so that you can get used to the way the medicine feels. And again, you're gonna have that support. So if you're somebody in that latter category, maybe you wanna go for the option on our website that includes the therapist in the room with you the entire time. Your therapist will, if you want it, hold your hand for the journey. So if you're feeling really nervous, uncomfortable, that person, sorry, I'm reading the questions as I'm talking. So many good questions. That probably going to want to have some more support. If you're somebody who's had all 20 good journeys with medicines, if you've gone to Amsterdam and taken recreational psilocybin in your 20s and you did that 5 times, then we can probably go a little bit higher. But it is the personalized dosing and the medical and mental health supervision that I think is why we are, considered the gold standard of psychedelic assisted psychotherapy.
Got it. So what I'm hearing is, ketamine is safe. We start at lower doses and they kind of incrementally increase, both in consult with people's history and really some of their goals that they're set it out. And so what I've heard from clients is like there is some surprise to them at how collaborative their treatment program really is in conjunction with their medical team.
When I'm in the room with somebody who's new to us, so I'm with maybe May, our clinic manager, who's a nurse practitioner, or Dr. Randy, who's an MD, and me, and we're all talking, and the client is saying, wow, I'm really nervous, I really want to go low. We usually say, okay, let's go low. If there's a physical concern and we want to, we always monitor their blood pressure throughout the session, we're probably going to start low for your physical safety. If there are psychological concerns, if you have a severe anxiety disorder, you're feeling really nervous, we're going to go lower. If you have great experiences, we can go higher. But I think a lot of people are surprised of how much input the client actually has. This is your journey, right? So again, because this medicine is so incredibly safe, there are we covered them already, most of the concerns. So it is so safe. It's really about your experience and how do you think this is going to benefit. I tend to also recommend that people with untreated trauma, unprocessed trauma, start low and also have that concurrent therapy in the room, so that on the option on our website is the one with more support, because then your therapist, and I've done this in sessions, I process the trauma in real time with the medicine sometimes. And that's especially true in our lower dose sessions. So we call in the literature and the research, you'll see this sometimes referred to as psycholytic dosing. So psycholytic dosing is sub-psychedelic. So if we give you, let's say, 20 milligrams IM intramuscular in that injection, that usually allows people to have a, quote, psycholytic session, meaning that you can actually talk and process trauma through the whole session. If you go to medium and high dosing, so now we're talking about 50, 75, 100 milligrams IM, which is, you know, the bioavailability if you're using our at-home, which I want to talk about our at-home program at some point today. It's different, right? So usually roughly you're going to multiply our dose. You're going to, I'm bad at math, but so the equivalent, so around a third of the oral is absorbed versus almost all of the IM dose. So when I'm giving these IM numbers, I think because of laws in Canada, our Canadian clinics actually use the oral. So the equivalent of the low dose would be like 100, 150 milligrams, higher dosing looking at like 200 plus milligrams, or at the American clinics, the IM 50 to 100, that is a full psychedelic experience. So I've personally, in my training for ketamine assisted psychotherapy, had that experience and have experienced what ego death feels like. And I can tell you it is like you've heard in the research, in the Johns Hopkins studies, in the Michael Pollan book, it was one of the most spiritual and one of the most profound experiences of my life, and always will be. So if you're somebody who's like, I've seen it, I want that ego. I have a friend in New York, he's like, I would do anything for ego death. I've got to just, you know, I want to do a psychedelic so that I can have that. It will change the way you see the world. So sometimes these effects just aren't neurological, right? In terms of, oh, okay, what's it doing to your brain, and what's it doing to your neurotransmitters, and how is it helping your brain to make new connections? There are a lot of these aha moments, these spiritual ways of seeing the parts of yourself and seeing these aspects of your personality. And you can kind of step back and see that, you know, who is Conrad? Who is Mike? Like, who is the person who knows that there are these different parts of me that are doing different things and trying to protect my inner child, and how my inner parent, or some of the archetypes, the Jungian archetypes that I see pop up organically, like Merlin the wizard was in my journey, and Merlin was telling me this. Well, that's the wise man within you, right? Or the wise woman within you, and that part of your personality is trying to communicate with you. But who is the person, who is the entity who is watching all of these things? So a lot of times when you can use these different modalities of psychotherapy, it really helps you to have these spiritual aha moments to say, oh, I get it. So when there is some problematic self-destructive behavior, it reframes everything. And to me, those are some of the moments in people's lives that are the most miraculous, that really can help people totally change their lives.
Yeah, that's really great. You know, I've heard that kind of consensus too from some of our clients that say, like, you know, they were able to, with the ketamine and the psychotherapy, start to observe some of their trauma in a different way, a little bit separate from the way that they had in the past.
Yeah.
And I love that analogy, and I see it too, is this idea that you kind of become an observer as you continue to do this work.
Yeah, it's that the self, right? The capital S, or in mindfulness practices, you know, who the observer. If you've ever done, for those of you watching, if you've ever done the classic mindfulness meditation of the thought stream, and you start to watch your thoughts and feelings in a stream, who is watching that stream? So that is the self. And when you make contact with self, so you can do that with 10,000 hours of meditation. You can probably access what we're going to help you to access with the medicine, but some people need a little bit of help. So in many ways, I find that my own ketamine work, my own sessions have helped my transcendental meditation go even deeper. And I think the transcendental meditation that I practice has allowed me, it prepares me for the ketamine sessions. And so in our instructions and in some of the therapy sessions that we have with people before and after their exploration, or the medicine sessions, we give a lot of those instructions. You know, it's how are you going to live your life? And with this increased BDNF that helps your brain make new brain cells, new connections, with more dopamine, with more serotonin, how are these changes going to start to feel possible, sometimes for the first time?
Got it. Okay. You know, that was great insights. Thank you. I'd like to just quickly welcome those who might have joined us. Today we're talking with Dr. Dow. He is sharing a little bit around why ketamine and how it works and why Field Trip uses it as part of our ketamine-assisted therapy program. And in our last 15 minutes, Dr. Dow, I was hoping we could touch on a few of our audience questions.
Yeah.
One came from earlier to say, do we need a psychologist or an MD on the team to administer the dose?
So we have, if you come to any of our Field Trip clinics, we have a variety of healthcare professionals, so PhDs, MDs, nurse practitioners. So one of our medical staff is coming in. So the way it works is you're in our treatment room. You'll see on our website. If you go to our website, if you're interested, I encourage you to sort of look at the different programs we have. If you see on our site, we're going to allow 3 hours. So that's 2 hours in the treatment room with your therapist. If you choose the one that includes extra support, the slightly cheaper treatment modality is the one where your therapist is not in the room with you the whole time. And then that third hour, you can go to one of our integration lounges to journal and to really fully come back into your body. And sometimes you feel a little wobbly on your feet, so you can actually just have a really beautiful physical setting to do so. The nurse practitioner or the MD, our medical staff, is going to come in. They're going to do an assessment. They're going to hook you up to a remote blood pressure monitoring. That's what we use at the Santa Monica, Los Angeles clinic. So even though the medical staff is not in the room with you the whole time, they're actually monitoring your vitals remotely. If you do the option that does not include the therapist in the room with you the whole time, if you feel comfortable with that, we also have a camera so that people can see you. So if something happens and we see you getting up, or we have a nurse call button too, one of those little remotes, somebody from our medical staff will come in. I've never seen that happen. So, yes, we do have the medical staff. I think the one difference in our Canadian clinic versus our US clinics, if you are watching from Canada, in Canada, correct me if I'm wrong, Conrad, we do require a referral from your primary care physician or your psychiatrist. But if you're watching this in the United States, you can go right to fieldtriphealth.com and get started. So, obviously, if you are being treated by mental health professionals, you want to tell them, but you can get started with us directly.
Yeah, got it. So yeah, and just to clarify, in Canada, you do require a doctor referral, or you can work with Field Trip and get a referral with one of our doctors. And in the US, we do rigorous fit, and qualification assessments to make sure that we really our treatment is actually going to benefit you. And some of the core indications that we treat are treatment-resistant depression, PTSD, and anxiety. And we have a few others as well, which, we encourage anybody to get in touch with us to see if they do qualify for treatment, if Field Trip believes that we can help you just as much as you're hoping you can help yourself.
Yeah. We also have this really incredible, if you're in the states of California, Colorado, Florida, Georgia, Massachusetts, New Jersey, New York, Tennessee, Texas, or Washington. If you don't live near one of our clinics, we also, or if the $5,000 to $6,000 or even the payment plan of $200 to $300 a month is out of reach for you, we also have an at-home model. So that one is $1,250 total, which is obviously much more affordable. I know you and I, Conrad, are really passionate. We believe in this work. We wanted to make this accessible to as many people as possible. We know that's one of the reasons why we have the payment plans. $6,000 is a lot, but $281 per month is not that much. But if even that seems out of reach, $1,250. The difference between our at-home and in-clinic models is our at-home model, you're still going to do a medical assessment, usually with a nurse practitioner on a HIPAA-compliant, secured browser to make sure that you are a candidate for this treatment, make sure that you don't have any of those contraindications like pregnant nursing, schizophrenia, or uncontrolled bipolar, uncontrolled hypertension or active mania. And then they will do an online training, and somebody, a friend, a significant other, a family member, they're going to do an online training for them to be your sitter. So if you, and then there is an option to do an online group therapy with a licensed therapist. So whether you're doing, so there are really three different models, right? So there's the the at-home treatment, that includes a licensed therapist doing group therapy with a sitter who is not a therapist, who is somebody that you know, just a friend, significant other. There is the in-clinic with a therapist in the room the whole time. And then there is, you'll see that that's called the individual plus extra support at fieldtriphealth.com. That means the therapist is with you the entire 2 hours, every single medicine or exploration session, versus the individual treatment without the quote extra support. That means you're still going to have a licensed therapist do your preparation session online. You're still going to get just as many integration sessions. So you're getting 3 1-hour integration sessions plus 1 30-minute, plus your 30-minute preparation session. That's all with a licensed therapist. But during the medicine session, the therapist is not going to stay in the room with you for those 2 hours. So I think it's a lot of people are asking about that. So that's when you see the individual treatment plus individual plus extra support, that's the difference between those two programs.
Got it, got it. And actually, I see a comment earlier from Tanya Norris who said that she would need the extra support. She's never even been drunk before in her life. So certainly that's somebody who would benefit from that individual treatment in clinic with that extra support, at least as you kind of started to understand, what does this look like for you, Tanya?
Absolutely. And I think people like her, they actually know, most people know what option that they need, right? So I have now flying into Los Angeles, staying at a hotel near Field Trip to work with me or work with some of my colleagues. And if that is viable with your schedule, with finances, great. If that's out of reach for you because of work commitments, we really wanted to make this affordable. So insurance does not cover it. However, because our therapists are licensed, I provide super bills for the psychotherapy piece. And sometimes people can seek reimbursement, partial reimbursement for that time, because it is, while insurance companies do not reimburse for the medicine itself, they do sometimes reimburse partially for out-of-network mental health benefits for the therapy piece.
Got it. So in our last 5 minutes, there's a few more questions I hope we can try to get through. One question is, how helpful is it for autoimmune diseases, if at all?
Yeah, so I would say I am getting more and more. I have a lot of people that I treat at Field Trip with autoimmune disorders. So looking at thyroiditis, Hashimoto's, Lyme disease. It's really interesting, right? Because what we know about autoimmunity is that a couple things have to be present. Number one, you have to have the genetic loading. Number two, you need to have intestinal permeability. But the third thing that needs to be present is stress, right? And stress sometimes increases intestinal permeability, and it also turns on genes via epigenetics for autoimmune disease. So it's interesting. So it can improve your quality of life. It can, if the autoimmune disease is causing fatigue, the lift in dopamine that ketamine provides can help you to feel better. Some of the spiritual aspects, feeling like that seat of consciousness, the self that is experiencing that voice that's saying, why me? And the anger, right? Or the sadness, or the other parts that I do to sort of the way you relate to that disorder or that disease, it can sort of spiritually change that, right? So it gives people a piece of equanimity and peace. But also what's interesting, a lot of the autoimmune diseases are associated with inflammation, systemic. So that means through your whole body, inflammation that's not short-term, but long-term. Inflammation is a great thing. It's how your body actually deals with disease. But the problem with autoimmune disease is that your body is constantly attacking yourself. So there is usually systemic and neuroinflammation. Ketamine actually brings down inflammation in the brain. So if you're somebody with Lyme disease or another autoimmune disease, and also some hard to treat diseases, right? So chronic fatigue, PCOS, we're starting to see a lot of benefit. If you're in that, like, nobody can help me feel better category, we get a lot of clients who come to us and they say that they've tried everything. They've spent $200,000 trying to find relief. And most of the people that I've worked with say that this is the most effective treatment in terms of really rapidly improving their quality of life. And if we can give people quality of life back, I mean, that makes my day, worth living. So.
Yeah, that's really great to hear. Thanks for sharing those insights. We do have just 2 more questions. One is, how booked out are most of the clinics? Maybe I can just kind of field that to say,
Please.
our clinics are increasingly busy, but you can, depending on your location, get in quite quickly. You can go to our website, you can fill out a form or call our team, and you can start working with us, at least start the process within the next week or so. And understand like what part of your responsibilities you have to get, like whether it may be a referral, start to think about like your intentions and what working with us looks like. So it can happen pretty quickly. And please, I would encourage anybody who's thinking about it to just go to our website, fieldtriphealth.com.
Yeah.
Awesome. I have one more question that came from Not High. And I think this might be a great one for us to close on. Does there come a time when you don't need ongoing sessions?
Yes and no. So there are these spiritual aha moments. And if you have one of those spiritual aha moments that somehow changes the way you view your life, those benefits sometimes are going to last the rest of your life. So if that is somehow going to help you with your mental illness or your disorder or the things that you are experiencing, maybe. If you want ketamine is sort of a hybrid, in my opinion. It sort of acts like a classical psychedelic in terms of deactivating the default mode network like psilocybin, but it also, like modern psychotropic medications like SSRIs, it does lift the dopamine, the serotonin, the GABA, like SSRIs, like Wellbutrin, like benzodiazepines, but in a way that doesn't feel as problematic or addictive, comparing, ketamine to something like Xanax or Klonopin. So if you want those lifts in the neurotransmitters and the increased BDNF, if you want those, you do have to probably have move to maintenance. So again, in research, in our research, again, it's if you're just joining once on average, one session every 4 months after you complete the first 4 or 6 medicine sessions to start.
Got it. So we had one last question come in. Hopefully we can squeeze it in. Could you comment on ketamine's potential to induce manic episodes? How does ketamine generally impact sleep in the subsequent weeks?
So ketamine will rapidly lift your dopamine, which is why if somebody's experienced mania or hypomania, which is a psychosis, right? So schizophrenia, bipolar disorder, when you have excess dopamine that's too high, you're going to experience psychosis. So ketamine will lift your dopamine. So if you're already in mania or hypomania, we don't want to push your dopamine any higher. Now, for most people, if you're, remember, bipolar 1 and 2 disorder both include depressive episodes, or if you have major depressive disorder, which is also a polar disorder, meaning you oscillate between feeling normal and then these depressive episodes of 2 weeks or more, usually that's associated with low dopamine. So if you're in that state, pushing up your dopamine is a good thing. So again, we just want to be more careful with the way that we use it and assessing people. And that this is another reason why it's good to have licensed healthcare professionals who have training in diagnosing and knowing when it is safe to use this medicine. Sorry, there's a part B to that question. What was it?
If it had any impact to sleep in the weeks after sessions.
Yeah, thank you. So because it's a mixed bag. So some people, me included, I sleep like a baby after one of my own ketamine assisted therapy sessions. Some people, because of the excess dopamine, they feel a little wired. So sometimes it can lead to, not sleeping quite as well. Although I will say, as somebody who wears an Oura ring every night and I track my sleep, not only do I sleep better, but the other phenomenon is that nothing, I try to not eat anything 3 hours before bed. That improves my heart rate variability, which is sort of a measure of how well your, these systems in your body, the parasympathetic versus the sympathetic nervous system are sort of acting. Nothing will improve HRV, heart rate variability, which, the higher the score, usually the less stress your heart and your nervous system is under. Usually right after a ketamine session, people's HRV will spike. So I think there's, even if you have a little trouble falling asleep, if you're in that category, it's sort of a mixed bag. I think the rest tends to be more deep. And then what I do tend to find is because, one of the really tricky symptoms and the way depression is so pervasive is the way it really disrupts all of your other biological cycles, like your circadian rhythms and your sleep-wake cycles, right? So I usually find that by treating the depression, usually sleep will actually get much better for most people, even if in a handful of people, sleep for the next 2 days may be harder or maybe easier. It's this medicine, it's like a snowflake. No two people react exactly the same. So it is really hard to predict exactly what you are going to experience.
Got it. Okay. Wow, Dr. Dow, I want to, as we start to close, thank you so much for all these insights, this amazing information today, all around like ketamine. Why does field trip use it? How does it work on your body? What impact does it have on your brain and some of the conditions you're after? How we screen for fit to make sure that people are qualified for this treatment. How the results are sustained. We've heard about like legal access and our expert medical team and their role in all of this. So this has been a really excellent overview today on ketamine-assisted psychotherapy and why we use ketamine.
Yeah, and I think if we didn't get to your question and you're in doubt, you can always go to our website, Field Trip Health, book an assessment. If for some reason we deem that you are not a candidate, we refund that money. So there's really no risk just to get started and ask one of our trained staff.
Got it. That's really a great tip. And as we close, I'd like to just say, thank you to our audience for coming today, for participating. Some excellent questions. We love chatting with you. Thank you to you, Dr. Dow, for bringing your insight and expertise to this conversation and holding this space with us. I'd like to invite people to join us again next week. We're going to do another chat, same format, new topic. I think we're going to lean into integration and really understand what that's all about and how do people sustain the results and really implement the changes, and the insights that they're striving for.
Yeah. Can't wait.
Awesome. Thank you so much, Dr. Dow. Thank you to our participants today. We'll see you really soon.
Bye.